Welcome back. Joining me now with a commitment to treating his patient's pain without surgery or medication is Dr. Miliotto from our sponsors at Western New York Pain Relief and Integrative Wellness Center. Hi, Dr. Miliotto. Thanks for coming in.
Pleasure as always.
Let's talk about what you can tell us about your research-based treatment and how it works for people with nerve and joint disorders.
Yeah, so research and evidence-based medicine is just a medical approach of using therapies on individuals who have chronic nerve and joint disorders in the sole goal to actually help accelerate the healing process of that damaged tissue, improve functional outcome, quality of life, and most importantly, remove the use of medication, injections, or potential surgeries. The biggest thing about research and evidence-based medicine is this is not something that's new. It's been around for a long period of time, but medical management of people that have neck or back pain or nerve and muscular and joint disorders typically are put along the medical route, and they really don't know a lot about therapies that exist to help them take control of their own life.
That's right. What you do is focusing on not just mediating the pain for a time being so they can, deal with everyday life for a little bit. You're trying to stop it, right?
Correct. When people come to our office, I've done chiropractic, physical therapy, acupuncture. I had epidural injections. I'm now talking to a neurosurgeon or a doctor that's going to look into replacing my shoulder, my hip, or my knee. And our goal is to really just take a different outlook on it. When I was doing my residency, I was working at ECMC and Dent Neurologic. I worked with a lot of patients that had strokes, they had fusions in their neck and back, they had been through severe trauma, they were getting older and had stenosis. And I really didn't like the outlook on how things were going with people. One patient I worked with was there for 3 years after a cervical fusion, 3 to 4 times a week, no clinical improvement in their symptoms. I use a couple of the therapies at that time that were similar to what I have now, but not as advanced. Person comes in the next visit, states she had an incredible amount of pain relief in just one treatment. So when I started working on people, I knew that the way I was studying how I wanted to work on these nerve and joint disorders, I knew I was on the right path, and I just needed to get my own office, my own clinic, and start, which I've been doing for 8 years now.
Let's talk about what types of patients you tend to work with. We're seeing you working with the patient now.
Yeah, so the patients that come into my office, they vary in terms of age. We can actually start to get disc herniations most commonly around the age of 30 to 40. A lot of patients that come into the office, they're having balance issues. They have neuropathy symptoms in the hands or feet, which is numbness, burning, or tingling. I had a patient that came in earlier this week, a very common issue, where they're experiencing weakness and heaviness from spinal stenosis. But that person might not have back pain. They're getting symptoms in their legs and feet. Those are the patients that we work on because these issues are internal. They have to do with how the nervous system is being affected by spinal discs, the spinal cord, how the nerves are atrophying over time, which means weakening. And then in turn, that person is losing function. So a lot of times people think, oh, I have to go see the physical therapist. Well, sometimes physical therapy doesn't work for these underlying conditions because the problem is related to a disc or a nerve. And my sister's a wonderful physical therapist, but she will call me time in and time out and say, hey, I have an 80-year-old patient. They have a disc herniation or stenosis. I can't get that muscle stronger until you fix the issue that's affecting the muscle.
Mm-hmm. I want you to talk about how you come up with this form of medicine and how it helps someone manage their pain.
So the nervous system and joints all work together. Our body systems work in harmony. So with the neck, the back, nerves, and muscles, it's pretty easy. It starts with your spinal cord. Spinal cord has the nerve root. Nerve root controls the muscle. Muscle controls the joint activity. So if you have a problem with your back, and anybody that thinks about pain that they've had for a long time, eventually that back pain went up your back, down your back, into your butt, down your leg. These are all the systems being affected over time. So we use a series of treatments to help each of those issues. So for example, I might start with decompression therapy. Spinal decompression or non-surgical decompression is the most advanced treatment you can use for the neck or back with a 96% success rate at eliminating medications and surgeries. Then we go into a technology that helps to rehab damaged nerves and muscles. So this machine actually helps with immediate pain relief, while re-educating a nerve. So now the person starts to notice long-term pain relief, improvement in balance and strength. They start to notice numbness, burning, and tingling symptoms are going away. So the person's getting quality of life and pain relief. But now we want to get the healing process, and that's where our 2 medical lasers come in. We have 2 class 4 medical lasers that work on blood supply, oxygenation to damaged nerves and tissues, and circulation. So now we're bringing blood, nutrients, and oxygen into the important areas and removing the inflammation and the metabolic waste that is built up, which is why you feel chronic pain in that area. We will typically use these three therapies to get that highest level of pain relief.
Now, I know this is a lot of information, but you actually host these lunch and learn seminars. So can you tell us when your next one will be?
Yeah, so the next one coming up is May 15th. It's Wednesday at 1 o'clock. We usually host one once a month, every 3rd Wednesday. They do book up pretty quick, but it's an opportunity for people to learn about medications, things that they've done and why they haven't worked, what we do in the office, and more importantly, it's just about being an advocate for you, the individual, wanting to learn about how to live your life successfully and happily and not rely on doctor to doctor where you kind of feel like you're just being moved around and nobody's really helping you in the long term.
All right, Dr. Miliotto, thank you so much for coming in. And
Pleasure.
viewers, if you would like more information on how our sponsors at Western New York Pain Relief and Integrative Wellness Center can heal what hurts, visit their website or call the number right there on your screen. Thanks again for coming in, Dr. Miliotto.
Thanks for having me.